It's Tardive Dyskinesia, such a complicated name, I think. So let's just call it TD for short. And TD is a disorder of the body, of the muscles that control the body. So the face can have difficulty, the lips can move, the jaw, it can be the neck, it can be the fingers, and it is often a consequence of having taken some really important medications for the treatment of psychiatric disorders like antipsychotics. And it can be a condition, Jerry, that really negatively and badly affects a person's life. Very often, these wonderful folks have suffered previously from depression or bipolar disorder or schizophrenia, and they are taking these medications called antipsychotics for all the right reason. But the unintended consequence for some of them is the development of this condition. And my advice is if you see something, say something. As Miss Sherlin knows, and she's a real expert because she's lived with this condition, unless you bring up that information to your clinician, often the diagnosis is missed, and therefore an opportunity to treat it is also missed.
I was diagnosed with TD in 2018, and prior to that, TD, the symptoms were in my face, mostly around my mouth. My lips quivered, the left side of my jaw sagged really heavily down. My speech was slurred, and people thought that I had a stroke. I went to the doctor. I didn't have a stroke. He didn't know what was wrong. I didn't have a name to put with what was going on with me. And that was trauma inducing, to say the very least, to know that you have something going on in your body and not knowing what it is. Fortunately for me, I went to my mental health clinician and he diagnosed me with TD. It felt absolutely wonderful to have a name to go with what I was suffering from. Well, prior to being diagnosed with TD, I just was ashamed of my life. I was ashamed to be around people. I didn't want to talk to friends. I had a personality transplant, if that's at all possible. I just wanted to be left alone. And there was a great deal of shame, something I'd never experienced in my life. But as a result of getting the TD diagnosis, I'm more confident. I feel like I can enter the world again. And as a matter of fact, I have a greater appreciation now of my situation because I was on the other side of it where I was just terrified of what was going on with me. And the wonderful thing is that I don't have to make a choice between what I should do. I can take care of my TD and my mental health, and I do not have to choose between the two.
Recently, Austedo XR was approved by the FDA, and I'm very pleased on behalf of Teva to talk about that. It is once a day, one pill, once a day treatment option that has been approved for the treatment of tardive dyskinesia, and it's actually really big news. We should, of course, keep in mind that safety and benefits both need to be discussed. We do have 3-year data, 3 years of people with tardive dyskinesia getting benefit from Austedo. We do note in terms of side effects, the clinician and the patient should work on it, but sleep problems and nasopharyngitis were difficulties. But some people saw benefits as early as 2 weeks, even after they'd had the disorder for years and years and years. So for me, big news is not only this recent approval of one pill once a day, but also the fact that people with underlying psychiatric disorders could receive treatment for that and receive treatment for tardive dyskinesia at the same time, which makes me as a clinician extremely happy. Information's power. So I would encourage people to go to austedo.com, and I'll spell that if it's okay with you. Austedo, austedo.com. And it's chock full of very good information. So I'm encouraging people with potentially who have TD, but also their family members to go check it out.